New cases of COVID-19 are spiking across the region. Taking a look at Minnesota, the state is reporting high deaths, which indicate the virus is still affecting older and more vulnerable people. And on top of that, the state faces a shortage of healthcare workers. WCCO's Liz Conklin has more from the Twin Cities.
And this is a hard time, and it's really being a long road.
For 7 months, Dr. George Morris has helped us navigate the ever-changing numbers. A series of marathons, he says, that for weeks have caused concern.
I think the schools opening up, colleges, more people kind of circulating, Labor Day.
As younger generations are infected, Dr. Morris believes COVID-19 is being passed to an older, more vulnerable population.
What I've kind of looking at is that this surge is not just going to be a quick peak.
A new record of positive cases in Minnesota shows 2,297 people are now infected, as testing has increased 65% since last month. Double-digit deaths tied to COVID-19 have been reported on 6 of the last 8 days in the state. Dr. Morris acknowledges the difficult week of data, but it's a different number that's standing out to him.
We have the beds, we have the supplies, the ventilators. It's our staffing.
Minnesota's Department of Health has tracked 10,000 healthcare workers for months. In June, it found 24% of high-risk healthcare workers have been tied to some kind of home exposure. That number's climbed to 62%.
We need them at work right now more than ever.
It's why Hennepin Healthcare today made it clear these critical workers are needed back at their care facilities.
End to end across the health system, any of our staff that are involved in direct care being out has an impact.
Liz Collin, WCCO 4 News.
As illness and deaths related to alcohol continue to rise, a new study suggests setting a minimum price for drinks could help. Researchers in Canada looked at deaths and hospitalization data as well as local alcohol sales and pricing. Their models estimate that a minimum price of just over $1 per drink would have prevented nearly 6% of alcohol-related deaths. A $1.30 minimum would have cut deaths by 11.5%. Experts say setting a floor price prevents the sale of cheap drinks with high alcohol content. And a major contributing factor of coronavirus outbreaks in nursing homes may be due to asymptomatic transmission. That's a study from Brown University out this morning. The researchers looked at over 5,000 COVID-19 cases across 20 states earlier this summer. Overall, 40% of the cases were asymptomatic. Also, nearly a fifth were pre-symptomatic, and the remaining 40% were symptomatic. The scientists say there should be universal testing in these facilities in order to identify and isolate cases.